I'm delighted to be joined by Chris, John and Tim. Chris is from Vantage Strata, John's from Highrise Strata, and Tim is from LJ Hooker. CU Health is doing the very best it can to lead the way in health and wellbeing of employees. And I've learnt over the last couple of years the really taxing environment that strata managers work within, and that wellbeing is becoming an absolute priority to stabilise the sector, reduce risk within the sector, and also to just continue performing adequately. Chris, I might throw to you as someone who's obviously very experienced in the sector, like the other gentleman on the call. What do you think about wellbeing in the strata sector? How does it manifest as an issue, and what have you seen over the last decade with regard to employee wellbeing?
Yeah, thanks, Pat. Look, the strata, I think every job and every industry exists on a spectrum of, high exposure to potential psychological risk, and the strata industry, unfortunately, is right up that high end of the spectrum. I could wax lyrical on the reasons why, but just take my word for it. We send our team day in, day out into scenarios and circumstances where they are at genuine risk of psychological injury. So we see it manifest in burnout. Really great talented people who we desperately want to keep in the industry leave at a rate that I don't think any of us would be satisfied with. But it's upstream of that, frankly. It prevents people from wanting to come into the industry in the first place. And we've got a real crisis in the strata industry to make the conditions more attractive for talented professionals. And I think we've got a lot of work to do in order to create the conditions that results in that, frankly.
Thanks, Chris. What I'll go to John now. John, what's your experience? Do you see it the same way as Chris? How are things different state by state? I know you share a lot of information together, or is it an industry-wide phenomenon?
I absolutely agree with that. I think it is industry-wide. We're in the complaints management and handling business. There's ever-increasing pressures on the team to deliver outcomes for the clients in an unrealistic time manner. Just the pressures and demands on the team are never-ending. Any support we can provide there obviously deals in that lack of reduction in the burnout end, and obviously staff retention, longer relationships with the clients also results in better client retention and ultimate performance of the business as well.
Okay, it's just really interesting and I suppose reassuring for me that sort of leading CU Health to hear that there is a problem a genuine problem that we can help solve. Tim, you've partnered with CU Health for a while. I guess pre-CU Health and afterwards, what do you feel as though it's brought to the team with respect to the things that Chris and John have raised?
Yeah, well, I guess the things that John and Chris raised, that weren't 100% apparent before we partnered with CU Health, and they still are to a degree. But we're finding that the partnership with CU Health has led to, I guess, a more comfortable arrangement where the staff know they're supported through not only that measure but a few other initiatives that we as a company and the wider strata community are starting to put to our teams. It is one of the things that is really high on my company's agenda, to take care of my staff. That's the paramount sort of initiative that we've done over the last couple of years. And, the partnership with CU Health has only enhanced that. As I said before, the staff feel supported. There's an outlet and an independent, outlet for them to, have a chat with someone about, any stresses and that's not only in the workplace, but also anything they're going through personally that also helps them to perform at their best in the workplace. Since we've partnered with CU Health, we put it on our Seek recruitment ads that we offer this to our people. It's a topic that actually gets raised in interviews that I do with people for potential recruits. They really appreciate the fact that we're a forward-thinking business that has chosen to partner with CU Health, and create an environment that is one that they can feel comfortable working in.
Yeah, that's really interesting to hear, because it seems as like there's sort of a whole spectrum of reasons that well-being overlays or impacts the way the business functions. You sort of alluded to there the support function on an ongoing basis, but also the retention or attraction of talent and leading with it when it comes to job descriptions and recruitment, which is really interesting. A sort of general question, and I'd love a quick answer from each of you. When it comes to salary now as sort of a tool to retain talent and demonstrating care or well-being, where do you think well-being and salary are sort of equal now in terms of the perceived value, or will people chase a bit more money and forego well-being and culture? Like, do you think that well-being is a significant lever with respect to retaining talent and building performance within a team, Chris?
Yeah, look, I'll give you, it's a complicated answer and probably not the one you're after. I think, like, our industry has been, unfortunately, in this, addicted to this war of salary because the supply constraints have been so difficult. That was really the only lever we had, right? So, unfortunately, that's the world that you've occupied probably for the entire time we've been in business. But it's what's clear to me, and I'm sure John and Tim will agree with me, that to a person, that just has a diminishing return for them. There's definitely a diminishing return for the business, just another $10,000 to stop you from going elsewhere, and that just, like, you got to pay another $10,000 to poach someone else just to keep up with your growth. That, for a business, has an obvious diminishing return that's not too hard for people to work out. But for the individual, it does too. And we see, so often the case that someone chased the extra money and left, and they were like, actually, it wasn't sufficient for the conditions that I've been, exported to. I actually regret doing that. So I think it becomes a lot more relevant, but it needs to play out within our industry such that those. First of all, we've made it a place where people aren't burning out at such a high rate that you're constantly trying to backfill and then compete with your competitors to just keep your head above water in recruitment. So it doesn't have a nice, it's a journey. I think we're on a journey as an industry.
Yeah, I don't think you're isolated in that either. Sorry, John, we can.
I was going to say that. Definitely agree, Chris. I think as the industry's maturing, those good, experienced, top-tier strata managers that we want to retain forever, they're maturing in their thinking as well. More aware around all the different psychosocial risks and hazards that come with this wonderfully rewarding industry, but certainly the challenges associated with it. So, your top-tier managers, for the sake of an extra 10 grand here and there, they're already at such a level where they're being paid appropriately that it doesn't really make that much more of a difference. So yeah, absolutely on that attraction piece, but also on the retention piece, what else can we as businesses offer? But not just that, it's also, again, then giving back to the industry, back to the staff and the personnel around that holistic approach to their well-being. The flexi work arrangements and all those things were the rage back in the day. Again, that's standard practice now. In terms of work from home arrangements available and offering to staff. So it's really what's the next thing. But I think you've touched on it previously, Chris, as well. It's that sort of hard hat approach. The coal miners 200 years ago went into battle without any protection, and then someone came up with a hard hat. All of a sudden, you start losing less of them down in the mines. Now, again, our workers on the front line are dealing with all of the social issues, psychological issues, mental health, downfall in society is just so prevalent now in all the buildings that we look after. There's almost not a building without, the old challenging person. Used to be 1 in 10, but now it seems to be more and more. So again, the better equipped the team can be in processing and dealing with that conflict, and without it impacting on them personally long term, the the better we can lift the industry altogether.
Yeah, and I'm sorry to jump in, but I've cultivated sort of a line that I've been using over and over. I think we all are congratulating ourselves for being so forward thinking and having this great initiative and great CU Health. I am proud of it, but the more I think about it, the more I think, well, is it an innovative outlier sort of thing, or is it just necessary, you know? And the mine shaft is a great example. No one at BHP gives themselves an innovation award because they have protective gear when they send people into dangerous work conditions, and they don't celebrate with awards the fact that they had doctors on standby when the injuries invariably happen. And I think that's how we need to view this. It's great, we should be proud of it, but this is necessary. This is not surplus to requirements. This is meeting requirement, and I think as an industry we are deficient in meeting that minimum requirement.
That's a really interesting point, Chris. I mean, obviously, I agree with that, and that's why we're doing the work we are. But one of the things that John said is also, when you join the 2 points, John, you were saying that, you know, you've got your strata managers that are going into quite psychologically unsafe environments sometimes to deal with difficult situations. And then you've got tenants or whatever it might be, and there's an increase in potential interpersonal conflict, which is increasing over time. And I would, from my perspective as a physician, as a doctor, I suspect that the reason for that is the prevalence of mental health issues in the community has been steadily and quite markedly increasing over time. So you've got your employees that are exposed to that mental health risk that's increasing, and that's for a different podcast, but it's a fact. And then you've got tenants who are, so those headwinds are sort of meeting each other, and you're dealing with a sort of friction-filled environment all the time due to everyone's limited capacity to adapt or to have, make space for themselves. There's very little space left. Now, under those conditions, you're all being asked to implement new guidelines and compliance requirements around psychological safety and psychosocial hazards, and they vary state by state, but under the legislation, there's now a obligation for directors of organisations to have certain things in place that look after the health and well-being of their employees. It used to be a nice to have sort of thing and a reactive thing, and now it's moving into an obligation. And the obligatory part of it's sort of the floor, and then everything above that is really where you can see the return on investment for looking after your team. So I'm interested, Tim, you would be receiving a fair bit of correspondence, or it's circulating around the emails, psychosocial safety, psychological hazards. I know I've been invited to, I think, Mudgee next year to speak to strata managers on the legislative requirements. Do you feel as though there's a uniform understanding across directors in the space about what their obligations are, or is there a lot of, I suppose, anxiety, confusion at the moment about what's required?
I think there is a level of confusion, but I do think it is more of a common understanding of directors in the strata space, more so than ever. I was attending, I think Chris was there as a leadership forum in Cairns about 1.5 years, 2 years ago, and we talked about then about these regulations, these laws coming into effect that places responsibility on employers to provide a psychologically safe workplace. And so I think it is something that people are aware of. I think it's something that people are still exploring in terms of how they can implement it. And that's where when we took the plunge a couple of years ago to go to CU Health, it was basically just after that conference that I thought, well, we as a business needed to do something in that space. And at that time, I didn't know what I could have sort of done to provide that in terms of to provide that safe workplace. And then Chris introduced me to CU Health, and that was something that I felt was at the time anyway, or above and beyond sort of the call of duty, if you like. But as Chris alluded to just before, I now see it as the necessary baseline for businesses in the strata space.
Yeah. Okay. Now, I guess the other side of it is what we knew, for me, as sort of someone looking at how do we do this best for you, there's two parts to it. There's organisational well-being, which is almost like and that's where that psychologically safe workplace tools and requirements come into it, because what you're looking at there is do you have clarity around roles and responsibilities? Can feedback be given in a safe way? Are people aware of what the mission of the company is, what their KPIs are, and are they supported in order to achieve them? All of that stuff is organisational, and that's sort of, I guess, the thing that everybody is part of. I mean, that's the way you create a community rather than a workplace. And then there's what I call the below the waterline, sort of below the tip of the iceberg stuff, which is personal well-being. And personal well-being is that individual's mental health, that individual's social circumstances, and their medical needs and so forth. And I think when you pair the two, an organisationally safe space and a personal well-being tool, you kind of are doing things from both sides, and you're going to have good outcomes. Now, Chris, not to put you on the spot, but you be aware, without any identities, of course, being given, you've been the CEO for a while. From a human perspective, what kinds of things has CEO helped Vantage Strata with in the health and wellbeing space? Any individual stories you're aware of?
I've got a couple of really, really salient ones actually, but I'll first address the result of the utilisation that really surprised me. First of all, really, really high utilisation, and we've had plenty of other programs in the past that to be best described as gimmicks. They weren't intended to be gimmicks, but that's kind of how they play. Gym membership and athletes would do discounts and that sort of stuff. And you'd be lucky to get a couple of people that would participate. And often people would go, I was thinking, why aren't people membership of this gym that we've got a program? And people go, I didn't even know about it. And it's like, it goes to show how well it was executed, which is really important, execution. But when we launched CU Health, not only did so many people participate in it, I was embarrassed to see the result of the kinds of services people were accessing so frequently. GP was obviously the highest. That's what I thought it would be. People would save time by going to the GP, and it would save me hours of people being out of the office waiting in the waiting room. Really wasn't the case. GP was high, obviously, but really close second, like neck and neck, was psychological access. And that trend has maintained all the way through, 3 or something years into it. So what that told me was there was an unmet need amongst my team. Now, whether it was because of their work or their personal circumstances, it sort of doesn't matter. They had an unmet need. If people were showing up with, the broken arm to work, like they need to treat that. And I was embarrassed, frankly, to see how under-supported that need was. A couple of really key examples, of people who have been happy to share with me and their comments to be shared publicly without their identities being revealed. 2 people within my team have said, this saved my life. And they didn't mean that metaphorically. They believe that it saved their life, and it was from that psychological treatment access.
Yeah, thanks, Chris. All right, well, look, it's been wonderful sharing thoughts with 3 leaders in the Strata space. We'll continue to learn more about the space, contribute to it, share their thoughts, hopefully make your workplaces thriving over time and the whole industry thrive. I'll catch up with you in the various states and cities that you're in, and wish you all the best. Hope you have a lovely summer break, and we'll see you on the other side of it. Any final comments from anybody?
Oh, look, I know I talk more than everyone else, but I do have a final comment, and it's, Tim touched on it. Like, I introduced this to CU Health to Tim. We're competitors in the same market, and people think we're best frenemies. Sometimes they follow each other, and there's healthy competition. I'm pretty sure John reached out to me to ask for information about CU Health, and I was happy to share it with him. We all have our competitive advantages, but I think everyone here on this call would agree. Actually, we want this kind of thing for our industry. I don't want this as a competitive advantage. I want every single one of my competitors to be utilising CU Health or something like it. And that comes down to, pride and wanting what's best for the community that we work within. So I hope others agree with that as well.
Yeah, I completely agree with Chris. It's about making sure our industry is resilient and sustainable If we keep going down the path we were going down, we won't be able to find any strata managers. By providing these services, and this support to our staff, it is an industry that people want to be a part of now. It's an industry that people will continue to be a part of into the future, and recruitment is going to be, and retention is going to be much easier going forward with programs like the CU Health.
Well, and I think definitely it's more than just your traditional employee assistance program, which is something that can be put on the shelf and gathering dust. In terms of the broad range of offerings, we're obviously talking around that psychological side of things, but even just the straightforward health offerings of the annual health checkup. Prevention's better than cure, and early detection, obviously very important. So another piece that we strongly encourage our team to do, and I certainly found benefit myself on as well.
Great. Thank you, gentlemen. So I guess any strata managers, directors, they're interested in this cuhealth.com.au. We'll see you on the other side. Thanks very much.
Thanks, guys. Good to see you.